The Biden administration is working to expand accessibility to monkeypox vaccines nationwide.
Now, this decision for the White House to ramp up its inoculation campaign comes as cases of the virus slow in some cities, but from coast to coast, they're still climbing. Nearly 19,000 cases of monkeypox have been confirmed in the U.S. In order to slow this spread, the Biden administration unveiled a new plan which aims to get doses in the arms of Americans who previously lacked access. Joining us now for more on this is Dr. Demetre Daskalakis. He's the White House Deputy Coordinator for its monkeypox response. Dr. Daskalakis, thank you for your time today. As we just pinpointed there, the administration now shifting its distribution plan with its equity intervention pilot. Now, with the virus spreading all over the country, how important is this new initiative and how is it different to what's been previously done?
Great. First, I want to thank you. Thanks, Errol and Tanya, for having me on. And so the equity innovation pilot is really exciting because it addresses what we're seeing in vaccine uptake. We're seeing that vaccine is being delivered, but that we are seeing lower numbers of vaccine going in Hispanic and or Latino and Black Americans' arms, as you'd expect, given the fact that they are actually representing the majority of new monkeypox infections. So it's an opportunity for us to do both things on a large scale and a small scale that actually brings vaccine closer to people, as opposed to putting vaccine out and having them try to find it.
And as Errol mentioned at the top there, Dr. Daskalakis, monkeypox cases do appear to be slowing in some larger cities. But what is the White House doing to ramp up its inoculation campaign for those at-risk populations outside of these large urban areas?
Yeah, no, I'll say that has been relentless, the work that we've been doing to make sure that we're getting vaccine in arms, specifically among populations at risk. And just to be clear, that's gay, bisexual, and other men who have sex with men. And so we're really working to really increase vaccine access in several mechanisms. One example is the ability to get multiple doses out of one vial. So that means that what vaccine we do have on the ground is going further. The other strategy has been to really increase production. And what we've done is increase production of the vaccine overseas, but have now also worked to actually generate a fill and finish plant, which means putting the vaccine in the bottle domestically, both of which mean that we're going to have a really good flow of vaccine to keep up with the pace and the demand.
Now, we've spoken about the kind of disproportionate dynamic of this thing. Black Americans have received roughly 10% of the vaccines distributed nationwide. What is the accessibility issue that you're trying to undo?
There's so many historical issues as well as issues specific to this vaccine. So I think that an example is that very often the way this vaccine is marketed to people in the jurisdictions is that here's a vaccine event and you have to come if you are a gay, bisexual, or other man who has sex with men who has multiple partners. That's automatically a barrier. And so the goal really is to bring vaccine closer to people and to really use the initiative of local jurisdictions and local organizations to figure out how they can actually deploy the vaccine better to get it to the people that need it.
And Doctor, you know, we are clear that the highest risk group right now is men who have sex with men. But what would you tell parents with younger children? Because as of August 21st, we know there were also 17 cases of monkeypox reported in kids across the country. And we also understand that it can present more severely in children. So what advice do you have for parents who are concerned about their children as they return to the classroom for the new school year?
So definitely I want to acknowledge that the concern is important. It's about knowledge and awareness of monkeypox rather than anxiety. So the bottom line is that the majority of cases, well over 90%, are among gay, bisexual, and other men who have sex with men, and it's often associated with sexual activity. There are other ways that monkeypox can transmit through other skin-to-skin contact, through close respiratory secretion exchange, but like for prolonged times, and potentially from touching materials that someone with monkeypox has had. So those are the ways that it can transmit, but the way it's actually transmitting most commonly in this outbreak is sex, and specifically sex that's occurring among gay, bisexual, and other men who have sex with men. So I would tell parents, be aware. If you see a rash that you don't understand, it's always good advice to get your child seen by a clinician, but not to have crushing anxiety, just awareness.
All right. White House Deputy Coordinator for the monkeypox response, Dr. Demetre Daskalakis, thank you so much for joining us. We appreciate it.
Thank you so much.